So next up is the Ernest A. Lynton Award for the Scholarship of Engagement, which recognizes full-time early career faculty who connect their teaching, research, and service to community engagement. It is my pleasure to present the 2026 Ernest A. Lynton Award for the Scholarship of Engagement to Dr. Martha Carvour, Assistant Professor of Internal Medicine and Epidemiology at the University of Iowa's Carver College of Medicine and College of Public Health. Say some fun things about you. All right. I just let them know I'm going to say some good things and then they can talk. That's how it goes. Dr. Carvour is recognized for her research, which focuses on improving health systems, building collaborations between academic centers and local communities, and reducing health disparities. She serves as an associate director for the University of Iowa's Medical Scientist Training Program and is the inaugural vice chair for quality and safety for the Department of Internal Medicine. She oversees a robust, cross-campus, community-engaged research and education program in the health sciences that has had a sustained statewide impact and has established a successful model for engaging students as leaders and scholars. So please, once again, join us in congratulating Dr. Martha Carvour for receiving the 2026 Ernest A. Lynton Award for the Scholarship of Engagement.
Thank you so much, Nicole, for that introduction. My name is Martha Carvour. I'm a physician scientist at the University of Iowa, but I'm really here representing a team. Our team's work is focused, as you heard, on health systems and how those systems can better serve the people that are interacting with those systems. That includes patients and community members whose health is affected by those systems. It also includes people that work day after day in those health systems, and students and clinical residents and fellows who are getting their education or learning in those systems. We certainly recognize that health systems and public health and healthcare systems alike are under a lot of pressure, are undergoing periods of tremendous challenge and uncertainty right now. We see this in two ways. First of all, it's our job as academics, it's our job as scholars to tackle big problems. And these are problems that we will challenge. These are problems that we can solve working together. The second way that we see these challenges is that a challenge is also an opportunity to change how we fix the system, how we approach the system. How do we ask and answer questions? Who's at the table, deciding which questions matter, and how we approach the solutions to those systems. As I said, I'm representing a whole team. I want to recognize some of those team members today. Aloha Wilkes is our program manager who's worked with us over the last several years. We travel the state. We work with student leaders at the university. It has been a true privilege to do this work with the student leaders that we partner with and the community partners throughout our state. We have more than 50 student leaders that have brought their ingenuity, their energy, their ideas, and their leadership to the work to improve health systems in our state, in their state, in the state where they're training. This includes medical students, pharmacy and dental students, as well as graduate students in public health and across the campus, and undergraduate students who are thinking about where they'd like their own careers to go in health or science careers. Also, really have to recognize the community partners throughout the state who have brought their ideas, their leadership, who have partnered with us on health systems improvement successfully over the last several years. Despite those challenges and those hurdles, it makes me optimistic to do this work every day. Many of those partners are in rural areas of the state, and many of those partners are grappling with a blizzard today, even while I'm standing here in front of you in this tremendous recognition of our whole team. I want to thank Campus Compact. I want to thank Brown University and the University of Iowa, the university-wide Office of Community Engagement, Jan Warren and Nick Benson, my Department of Internal Medicine, who sees the potential in what we're doing and has supported it, and the health system who stands behind us. Thank you so much. I look forward to learning from you all at this conference.